Okay, moving on. In what seems to be a move to decongest Kenya's biggest psychiatric hospital, Mathare Teaching and Referral Hospital, the Ministry of Health says it plans to hire more personnel to address its human resource needs. Speaking during an impromptu visit at the facility, Health Cabinet Secretary Susan Nahumita said there was need to devolve the services to facilitate accessibility of mental health services besides decongesting the facility. Gloria Milimu tells us more.
It was business unusual at the Mathare Teaching and Referral Hospital following the arrival of the health boss, who was on a fact-finding mission following concerns raised by senators on the status of mental health services in the country. Her impromptu visit unearthed the facility's need that continue to impact on service delivery, like the shortage of psychotropic drugs for patients and access to outpatient services using the National Health Insurance Fund, NHIF.
Hizi madawa za bei kali zinaletwa hapa na KEMSA, si ndio? Well, how do they disappear?
I want to check and ensure that the psychotropic drugs that are needed here are amongst the items that have been tendered for, and eventually that when the institution orders, they are able to be supplied with those.
Similarly, the huge number of patients who throng the understaffed facility has now exposed the high demand for mental health services in the country that relies solely on the facility for the much-needed services.
Our capacity is 700 patients. The wards which are more congested are the male wards, where you find that a ward which has a capacity maybe of 45 patients can have as many as 90.
I'll reach out to the families of those who have recovered and they need to get home, and their families who are not aware. I will reach out to them through my office. But number two, I have to go and discuss with my colleague in under social protection that we must do something as a country to be able to have a place where those who have now recovered can be assisted to stay there as they wait until the time that their communities can accept them. And if not, then they can be kept somewhere where they can be engaged in meaningful and productive activity to assist the nation in other ways.
And in a bid to address stigma around mental health, the ministry says it will now partner with the facility to create awareness about mental health conditions.
Efficiency.
Gloria Milimu, KTN.
And the decision by